Question 1. A community health nurse is conducting a tuberculosis, TB, screening program. Which client should the nurse see first? A. A client who had a positive MAN2 test 5 years ago. B. A client who reports night sweats and weight loss. C. A client who received the BCG vaccine as a child. D. A client who was exposed to TB but has no symptoms. Answer: B. A client who reports night sweats and weight loss. Rationale: night sweats and weight loss are classic signs of active TB, which is contagious and requires isolation and immediate treatment. Test tip: always prioritize clients who are infectious or unstable over those who are just exposed. Question 2. During a measles outbreak, the community nurse should give priority to which group for immunization? A. Pregnant women. B. Infants under 6 months old. C. Children aged 1 year and older who are unvaccinated. D. Adults with a history of measles infection. Answer: C. Children aged 1 year and older who are unvaccinated. Rationale: the MMR vaccine is given at 12 to 15 months. Unvaccinated children in this age group are highly susceptible during outbreaks. Test tip: prioritize susceptible groups in outbreak control. Question 3. A nurse is preparing a health teaching plan for a family with a newly diagnosed diabetic member. What is the nurse's priority goal? A. To ensure the family understands the physiology of diabetes. B. To promote family support for dietary and lifestyle changes. C. To teach medication dosage and timing. D. To help the client count carbohydrates accurately. Answer: B. To promote family support for dietary and lifestyle changes. Rationale: in community nursing, family-centered care promotes better adherence and long-term lifestyle changes. Test tip: focus on family involvement and prevention in community settings. Question 4. The nurse is using the epidemiologic triangle to assess malaria in a village. Which element represents the agent? A. Stagnant water. B. Anopheles mosquito. C. Plasmodium parasite. D. Human host. Answer: C. Plasmodium parasite. Rationale: agent: Plasmodium parasite. Host: human. Environment: stagnant water that allows mosquito breeding. Test tip: agent equals cause, host equals carrier, environment equals setting. Question 5. A nurse is planning a disaster preparedness program. Which is the first step in disaster management? A. Response. B. Mitigation. C. Recovery. D. Preparedness. Answer: B. Mitigation. Rationale: mitigation aims to reduce risks and prevent disasters before they occur, e.g., enforcing building codes, assessing hazards. Test tip: disaster phases occur in order: mitigation, preparedness, response, recovery. Question 6. A nurse visits a family where both parents smoke indoors despite having an asthmatic child. What is the nurse's best action? A. Report the parents to social services. B. Educate the family about the effects of passive smoking. C. Suggest air purifiers. D. Ask the child to use inhalers more frequently. Answer: B. Educate the family about the effects of passive smoking. Rationale: health education is the primary function of community health nursing. It empowers families to modify risky behaviors. Test tip: in community health, education comes before enforcement unless there is abuse or imminent danger. Question 7. A nurse is conducting a community assessment. Which data source is secondary? A. Household interview. B. Observation during home visits. C. Local health department records. D. Focus group discussion. Answer: C. Local health department records. Rationale: secondary data are collected by others, e.g., census, reports. Primary data come directly from interviews or observation. Test tip: primary equals you collect it, secondary equals someone else already did. Question 8. The nurse uses the health belief model in designing a hypertension prevention program. Which principle does this model emphasize? A. Behavioral reinforcement. B. Cognitive development. C. Perceived susceptibility and benefits. D. Physiological adaptation. Answer: C. Perceived susceptibility and benefits. Rationale: The health belief model states that people act when they feel personally at risk and believe the benefits outweigh barriers. Test tip: focus on beliefs, motivation, and perception of risk. Question 9. A nurse is performing a windshield survey. What is the primary purpose of this activity? A. To gather first-hand data about the community environment. B. To evaluate hospital records. C. To conduct laboratory screening. D. To perform a census. Answer: A. To gather first-hand data about the community environment. Rationale: windshield surveys involve direct observation of the community, housing, sanitation, schools, and resources. Test tip: use all your senses during assessment, look, listen, and note patterns. Question 10. Which of the following is the best example of tertiary prevention? A. Immunization against hepatitis B. B. Screening for cervical cancer. C. Teaching self-care to stroke survivors. D. Health education about smoking hazards. Answer: C. Teaching self-care to stroke survivors. Rationale: tertiary prevention focuses on rehabilitation and reducing disability after illness occurs. Test tip: remember the 3 levels. Primary: prevent disease. Secondary: detect early. Tertiary: restore function. Question 11. During a community survey, the nurse discovers a high incidence of obesity among schoolchildren. What is the best primary prevention strategy? A. Providing free diet pills to parents. B. Organizing a community exercise and nutrition education program. C. Screening children for hypertension. D. Referring obese children to a hospital. Answer: B. Organizing a community exercise and nutrition education program. Rationale: primary prevention aims to prevent disease before it occurs through education and lifestyle modification. Test tip: always think health promotion first in community settings. Question 12. A nurse is educating mothers about oral rehydration therapy, ORT. What is the key teaching point? A. Prepare the solution using clean water and correct salt-sugar ratio. B. Use ORT only after intravenous fluids. C. Give the child plain water during diarrhea. D. Stop feeding until diarrhea resolves. Answer: A. Prepare the solution using clean water and correct salt-sugar ratio. Rationale: proper preparation prevents dehydration-related deaths in children. Continued feeding is encouraged. Test tip: always teach how to prepare and use ORT in diarrhea management. Question 13. A nurse is assessing a family's readiness to learn about home hygiene. Which observation indicates readiness? A. The family expresses interest and asks questions. B. The home is poorly ventilated. C. The family appears disinterested. D. The family has multiple illnesses. Answer: A. The family expresses interest and asks questions. Rationale: readiness to learn is shown by curiosity and motivation. Test tip: assess motivation and willingness before teaching, not just need. Question 14. A community health nurse is conducting contact tracing for a client diagnosed with hepatitis A. What type of prevention is this? A. Primary. B. Secondary. C. Tertiary. D. Quaternary. Answer: B. Secondary. Rationale: contact tracing aims at early detection and control of disease spread. Test tip: secondary prevention equals screening, early diagnosis, prompt treatment. Question 15. The nurse is organizing a home visit. Which of the following is most important before the visit? A. Bring gifts for the family. B. Obtain necessary supplies and client consent. C. Inform the neighbors. D. Visit unannounced. Answer: B. Obtain necessary supplies and client consent. Rationale: consent ensures privacy, and supplies promote safety and efficiency. Test tip: always consider planning, safety, and respect for privacy in home visits. Question 16. A nurse is teaching food safety. Which instruction should be included? A. Thaw meat at room temperature. B. Store cooked food at 40 degrees Celsius. C. Wash hands before and after handling raw meat. D. Eat leftover food within 7 days. Answer: C. Wash hands before and after handling raw meat. Rationale: proper hand hygiene prevents foodborne illness like salmonella. Test tip: prioritize hand hygiene and temperature control in food safety. Question 17. The nurse is assessing a patient's home for fall risks. Which finding requires immediate correction? A. Rugs secured with tape. B. Adequate lighting in the hallway. C. Electrical cords across walking areas. D. Handrails on stairs. Answer: C. Electrical cords across walking areas. Rationale: these pose a fall hazard, especially for elderly clients. Test tip: in home safety, remove hazards first, then educate. Question 18. The nurse's role during a disaster response phase is to: A. Conduct post-disaster rehabilitation. B. Evaluate disaster preparedness plans. C. Provide emergency care and triage victims. D. Identify. Answer: C. Provide emergency care and triage victims. Rationale: the response phase involves immediate care and life-saving interventions. Test tip: match the role to the phase, response equals action, recovery equals rebuilding. Question 19. Which of the following clients should the community nurse refer for tertiary prevention services? A. A client with a new diagnosis of diabetes. B. A hypertensive client with renal failure. C. A healthy teenager. D. A child with a mild cough. Answer: B. A hypertensive client with renal failure. Rationale: tertiary prevention aims to minimize disability in chronic illness. Test tip: look for rehabilitation or management of complications. Question 20. When evaluating a vaccination campaign, which outcome best reflects success? A. Increased number of clinics. B. Increased awareness about vaccines. C. Increased vaccination coverage in the community. D. Decrease in health education sessions. Answer: C. Increased vaccination coverage in the community. Rationale: the ultimate goal is immunization coverage, not awareness alone. Test tip: evaluate outcomes, not processes. Question 21. A nurse is teaching about safe water supply. Which practice is most effective in preventing cholera? A. Filtering river water. B. Boiling drinking water. C. Storing water in open containers. D. Using shared cups for drinking. Answer: B. Boiling drinking water. Rationale: boiling kills Vibrio cholerae, preventing disease transmission. Test tip: in sanitation questions, think boil or disinfect. Question 22. A nurse is counseling an HIV-positive mother. Which advice is correct? A. Stop all breastfeeding immediately. B. Continue breastfeeding if replacement feeding is unsafe. C. Avoid immunization for the baby. D. Share razors and utensils with family members. Answer: B. Continue breastfeeding if replacement feeding is unsafe. Rationale: who recommends breastfeeding if alternatives are unaffordable or unsafe, balancing infection risk and nutrition. Test tip: consider cultural and resource contexts in public health decisions. Question 23. A nurse observes that many families in a community refuse immunization due to myths. What should the nurse do first? A. Punish those who refuse. B. Report them to authorities. C. Conduct health education sessions to address myths. D. Ignore the situation. Answer: C. Conduct health education sessions to address myths. Rationale: education and communication are the first steps to counter misinformation. Test tip: always address beliefs and knowledge gaps before enforcement. Question 24. During a community assessment, the nurse notes high infant mortality. What is the most likely cause in low-resource areas? A. Genetic disorders. B. Poor maternal nutrition and infection. C. Environmental noise. D. Overuse of antibiotics. Answer: B. Poor maternal nutrition and infection. Rationale: in developing regions, these are leading causes of infant mortality. Test tip: think preventable causes in global health. Question 25. Which vaccination should a nurse check for a 2-month-old infant? A. MMR. B. BCG, OPV, DPT, and hepatitis B. C. Varicella. D. Influenza. Answer: B. BCG, OPV, DPT, and hepatitis B. Rationale: these are standard 2-month immunizations in most programs. Test tip: memorize immunization schedules by age group. Question 26. In family nursing, which approach views the family as a system interacting with the environment? A. Family as context. B. Family as client. C. Family as system. D. Family as component of society. Answer: C. Family as system. Rationale: this approach treats the family as a unit, not just individuals. Test tip: identify the focus, individual versus family versus society. Question 27. A nurse is preparing teaching materials for low literacy clients. What should the nurse do? A. Use medical terms. B. Provide lengthy written materials. C. Use pictures and simple words. D. Speak quickly to save time. Answer: C. Use pictures and simple words. Rationale: visual aids and plain language enhance comprehension. Test tip: match communication style to literacy level. Question 28. A nurse reports an increase in malaria cases after heavy rains. Which action is appropriate? A. Begin vector control activities. B. Wait for lab confirmation. C. Ignore unless death occurs. D. Stop all outdoor activities. Answer: A. Begin vector control activities. Rationale: prompt community action, draining stagnant water, spraying, prevents further spread. Test tip: act preventively and promptly in vector-borne diseases. Question 29. Which population group is most vulnerable to communicable diseases? A. Adolescents. B. Middle-aged adults. C. Infants and elderly. D. Employed adults. Answer: C. Infants and elderly. Rationale: both have weaker immune systems, increasing susceptibility. Test tip: vulnerable equals young, old, immunocompromised, poor. Question 30. A nurse finds that 20% of children in a village are underweight. Which term best describes this? A. Epidemic. B. Prevalence rate. C. Incidence rate. D. Attack rate. Answer: B. Prevalence rate. Rationale: prevalence shows the proportion of existing cases at a given time. Test tip: prevalence equals existing cases, incidence equals new cases. Question 31. A nurse teaches about mosquito control. Which is most effective? A. Burning trash. B. Covering water containers. C. Wearing thick clothing. D. Using air fresheners. Answer: B. Covering water containers. Rationale: mosquitoes breed in stagnant, uncovered water. Test tip: always focus on source reduction in vector control. Question 32. A nurse working in a flood disaster area should first: A. Provide routine vaccinations. B. Assess for contaminated water and sanitation needs. C. Begin reconstruction programs. D. Establish long-term housing. Answer: B. Assess for contaminated water and sanitation needs. Rationale: after floods, waterborne diseases are the greatest immediate risk. Test tip: in disaster response, assess and address basic needs first. Question 33. A nurse is educating teens about substance abuse. What strategy is best? A. Use fear-based lectures. B. Peer group discussions and interactive activities. C. Give only pamphlets. D. Avoid discussing peer pressure. Answer: B. Peer group discussions and interactive activities. Rationale: youth respond best to peer influence and participatory learning. Test tip: match education to age, culture, and motivation. Question 34. A nurse identifies a rise in new HIV infections. What is the first step in planning? A. Evaluate current control programs. B. Collect data to assess contributing factors. C. Conduct media campaigns. D. Train new nurses. Answer: B. Collect data to assess contributing factors. Rationale: assessment is the first step in the nursing and public health process. Test tip: always start with assessment before planning or action. Question 35. Which is an example of secondary data in community assessment? A. Interviews with local residents. B. Observations during visits. C. Census and hospital records. D. Focus group results. Answer: C. Census and hospital records. Rationale: these are existing data collected by others. Test tip: primary equals direct, secondary equals existing. Question 36. A community nurse teaches handwashing in schools. This is an example of A. Primary prevention. B. Secondary prevention. C. Tertiary prevention. D. Curative care. Answer: A. Primary prevention. Rationale: handwashing prevents infection before it occurs. Test tip: prevention equals primary, screening equals secondary, rehab equals tertiary. Question 37. When performing triage after an earthquake, which client should the nurse attend to first? A. Minor abrasions. B. Cardiac arrest with no pulse. C. Open fracture with controlled bleeding. D. Unconscious client with shallow breathing. Answer: D. Unconscious client with shallow breathing. Rationale: airway and breathing take priority in triage. Test tip: apply ABCs, airway, breathing, circulation, always. Question 38. A nurse teaches food handlers about typhoid fever prevention. Which point is most critical? A. Avoid contact with animals. B. Wash hands after using the toilet. C. Avoid spicy food. D. Store leftovers in metal containers. Answer: B. Wash hands after using the toilet. Rationale: typhoid is transmitted by fecal-oral route, hygiene is key. Test tip: identify mode of transmission to find the correct preventive action. Question 39. A nurse screens adults for hypertension. This is an example of A. Primary prevention. B. Secondary prevention. C. Tertiary prevention. D. Health promotion only. Answer: B. Secondary prevention. Rationale: screening detects disease early before complications. Test tip: screening equals secondary prevention. Question 40. A nurse plans to reduce maternal deaths. Which intervention is most effective? A. Training traditional birth attendants. B. Ensuring access to skilled birth care and emergency obstetrics. C. Giving free baby formula. D. Providing family planning brochure. Answer: B. Ensuring access to skilled birth care and emergency obstetrics. Rationale: skilled attendance during delivery prevents maternal mortality. Test tip: prioritize access to care and skilled personnel. Question 41. In community health, empowerment means A. Giving money to families. B. Making decisions for clients. C. Enabling people to take control of their health. D. Providing food supplies only. Answer: C. Enabling people to take control of their health. Rationale: empowerment builds self-efficacy and participation. Test tip: empowerment equals education plus participation. Question 42. Which is a core public health function? A. Direct patient care. B. Surveillance and policy development. C. Administering medications. D. Routine home care. Answer: B. Surveillance and policy development. Rationale: core functions, assessment, policy development, assurance. Test tip: memorize the 3 public health pillars. Question 43. A nurse is teaching about herd immunity. Which statement shows understanding? A. Only vaccinated people are protected. B. The entire community gains protection when many are vaccinated. C. It applies only to animal diseases. D. Immunity lasts for life. Answer: B. The entire community gains protection when many are vaccinated. Rationale: herd immunity occurs when most people are immune, reducing spread. Test tip: the more vaccinated, the less transmission. Question 44. Which principle is central to community health nursing? A. Care of the sick in hospitals. B. Focus on individuals only. C. Emphasis on health promotion and disease prevention. D. Avoid collaboration with other sectors. Answer: C. Emphasis on health promotion and disease prevention. Rationale: community health nursing emphasizes preventive and promotive care. Test tip: always choose prevention before cure. Question 45. The nurse uses data from a health survey to plan programs. What process is this? A. Implementation. B. Evaluation. C. Assessment. D. Planning. Answer: D. Planning. Rationale: using data to design strategies is part of planning in the nursing process. Test tip: data use equals planning, data collection equals assessment. Question 46. A nurse is advocating for vaccination policies. This represents which role? A. Clinician. B. Advocate. C. Counselor. D. Researcher. Answer: B. Advocate. Rationale: advocacy means supporting policies and rights that promote health. Test tip: advocacy equals voice for the voiceless. Question 47. A nurse educates food vendors on handwashing and waste disposal. Which principle applies? A. Curative care. B. Health promotion. C. Tertiary prevention. D. Epidemiologic surveillance. Answer: B. Health promotion. Rationale: it increases awareness and improves community hygiene practices. Test tip: health promotion equals education plus prevention. Question 48. Which data collection method provides qualitative information? A. Questionnaire survey. B. Interviews and focus groups. C. Vital statistics. D. Hospital record review. Answer: B. Interviews and focus groups. Rationale: these explore perceptions, attitudes, and behaviors. Test tip: qualitative equals words and meaning, quantitative equals numbers. Question 49. A public health nurse is assigned to develop a disaster preparedness plan for the community. Which component should be given highest priority? A. Coordinating volunteer training after disasters. B. Identifying community resources and emergency shelters. C. Providing post-trauma counseling. D. Conducting evaluation after the disaster. Answer: B. Identifying community resources and emergency shelters. Rationale: in disaster planning, resource identification ensures readiness and saves lives when emergencies occur. Tip: think before, during, after. Planning always happens before the event, focusing on resources and communication. Question 50. A community nurse provides home visits to a patient with a chronic wound. Which infection control measure is most important? A. Reuse gloves if they appear clean. B. Perform hand hygiene before and after wound care. C. Wash used dressings in hot water before disposal. D. Use sterile gloves for every home visit. Answer: B. Perform hand hygiene before and after wound care. Rationale: hand hygiene is the single most effective method to prevent infection transmission in all settings. Tip: on NCLEX, when infection prevention is tested, choose hand hygiene unless another option clearly prevents exposure. Great job, future nurses! You've just completed 50 community health nursing questions. Keep practicing, keep believing in yourself, and success on the NCLEX is yours. Don't forget to like, subscribe, and share for more NCLEX review videos. See you in the next one.